And Good Morning Nigeria. Today we shall focus on the burden of hypertension and efforts at controlling the public health challenge.
So imagine water trapped in a pipe for too long. The pressure builds, the pipe weakens, and eventually it can crack.
Yeah, not just crack, it can burst. You know, so many things can happen. That's sometimes what happens in the human body when blood pressure stays too high for too long. The blood vessels and vital organs bear the strain.
And that is why many people call hypertension the silent killer. Someone may look fine, feel fine, and still be living with a condition that is damaging the heart, brain, kidneys, and even the eyes.
And the truth is, you cannot always tell by appearance. Yeah, you can look so good, move around and all. The only way to know for sure is to check your blood pressure regularly.
And hypertension is generally described as blood pressure of 140 over 90 millimeters of mercury, or higher in many settings, and it often has no warning signs.
Some of the common risk factors include age, family history, being overweight, physical inactivity, high salt diets, too much alcohol, and other unhealthy lifestyle habits.
So this morning we will be looking at what drives hypertension, how it can be managed, the daily habits that can help prevent it before it becomes a bigger problem, and most importantly, we explore how innovative funding can bridge the gap between policy and patient survival. I'm Victor Azo. Thank you for joining us on Good Morning Nigeria.
Indeed, Victor. Beyond that, with the 2026 budget signed into law, the Non-Communicable Diseases Patient Advocacy Working Group, with support from Legislative Initiative for Sustainable Development, that's LISTEL, and the Global Health Advocacy Incubator, is advocating a critical shift in how we finance the fight against hypertension. Ami Ray John, welcome to this very interesting program today. I'm sure you want to stay put for it. You want to know all about hypertension and how you can stay away from it. It's a good Friday. Is it a good Friday or a bad one?
Well, there's only one Good Friday, as we know it. But
I agree.
I thank God it's Friday.
Friday, yeah. So, every Friday should be good to us. And, of course, on Good Morning Nigeria, this Friday, we intend to make it a good one for you. So stay with us. Abubakar is right here. He's ready.
Often called the silent killer, hypertension or high blood pressure is one of the most serious non-communicable diseases affecting Nigerians today. About 1 in 3 Nigerian adults is estimated to live with the condition, with even higher rates in urban centers such as Lagos. Key drivers of the health challenge include unhealthy diet, stress, obesity, smoking, alcohol use, and low level of physical activity. Though medical experts emphasize hypertension can be prevented and managed through early detection, healthy lifestyle, and consistent treatment, they encourage reduction in salt intake and regular exercise. Other lifestyle changes could also include maintaining healthy body weight, avoiding smoking, and limiting alcohol consumption. From medical research, many Nigerians still struggle with high blood pressure control, raising the risk of complications such as stroke, heart failure, and kidney disease. Beyond health impact, hypertension is also an economic and development challenge, placing growing pressure on families, healthcare systems, and national productivity. Despite rising cases, funding for non-communicable diseases is often limited as competing priorities, especially infrastructure, dominate budget allocations. The 2026 national budget has been signed into law. An advocacy group, including the Non-Communicable Disease Patient Advocacy Working Groups and supporters, are calling for stronger policy and financial commitment, including better use of the 15% Abuja declaration target and revenues from the sugar-sweetened beverage tax. Government, health agencies, and the World Health Organization have introduced awareness campaigns, screenings, and treatment programs to improve access to care, but challenges such as poverty, weak health infrastructure, shortage of drug, and limited rural healthcare access persist. As the burden grows, key questions remain. What lifestyle habits place Nigerians at greater risk? How effective are current awareness campaigns and treatment programs? Are existing budgetary allocations sufficient to address the growing challenge of hypertension? And what more can government, stakeholders and citizens do to reduce the burden of the disease and improve access to quality care? This and more will shape our conversation on Good Morning Nigeria as our guests join us in the studio.
All right, many thanks Ibrahim Bello Gunda for the background report. Now time to get into the conversation. And joining us right here to talk about controlling hypertension, we have Emmanuel Al-Hassan, Professor of Psychology at Nasarawa State University and Country Lead Health Advocacy Incubator, Health Systems Strengthening. Many thanks for joining us, sir.
Thank you.
All right, also here for the conversation is Professor Felicia Anuma, Executive Council Member, Nigeria Heart Foundation and NCD Alliance. It's a pleasure to have you, ma'am.
Thank you very much.
All right.
All right, we have also been joined here in the studio by Francis Okonkwo, Member, NCD Patients Advocacy Working Group. We appreciate you coming on.
Thank you very much.
And also here in the studio, joining us from Lagos via Zoom is Nanlop Obureke. She's the Executive Director, Resolve to Save Lives Nigeria. Thank you very much for joining us on the program.
Thank you for having me.
All right, Yanri.
All right, we should set a foundation for the conversation. And of course, I'd like to get to Professor Emmanuel Al-Hassan. I'd like you to tell us what exactly is hypertension and why is it termed the silent killer?
Hypertension is a silent killer because many times you don't really have symptoms. Hypertension is, typified by increased, blood pressure, high blood pressure. Sometimes, of course, you have symptoms. And one very key thing about hypertension is that it is caused by sometimes predisposition, psychological factors like chronic stress. And you know that right now in Nigeria, many people are actually facing a lot of stress due to family pressures, financial pressures, unemployment, and all of that. So it's something that you can have without really knowing. And that is why it is very important for our health facilities to be equipped with all the things that are needed to screen early, and people encouraged to actually check their BP to ensure that we prevent hypertension. As also stated in the background report, things like excessive alcohol use, smoking, and lack of exercise, are all factors that can cause hypertension. And I think all stakeholders, including, advocates, including psychologists like the Nigerian Psychological Association, the NCD Alliance, and partners like the Global Health Advocacy Incubator, LISDEL, have been working to see that, Nigerians are made more aware about this, about hypertension, and steps need to be taken to prevent and also to curb hypertension.
All right, thank you very much, Prof. And to another Prof, Professor Anuma, thank you for joining us. Now, current data suggests that about 1 in 3 Nigerian adults may be living with hypertension. How did we get here?
Okay, thank you very much. Yeah, the prevalence of hypertension in Nigeria is alarming, actually. More than 25% of adult Nigerians are hypertensive. And if we are 220 million and you take 25% of that figure, that's a large number. We got here really because at some point we changed our lifestyle. We became civilized, We civilized everything around us, and so we began to acquire the diseases of civilization. Hypertension is a disease of civilization. Diabetes is a disease of civilization. And of course, the consequences, the complications of these two, for example, strokes, heart attacks, and so on, they are all diseases of civilization that we didn't used to hear about. But now, I mean, I work in a tertiary institution and a health institution, and every day we have cases of stroke, you know, that we didn't used to have before. And so, as we got civilized, there were certain behavioral changes we were meant to, you know, imbibe in order to prevent us getting there. For example, aging is a risk factor for hypertension. As we age, blood pressure tends to rise. If we don't want that to happen, then there are certain changes we must do. Our diet, we know what we have done, how much we have civilized our diet. Before, on Sundays, let me use that as an example. After church, people go back home to go and cook healthy meals at home to eat. That's what we used to do. But now, it is classy to go to these eateries, the whole family. And we are all there, you know, feeling good and feeling happy and eating all the things. That meanwhile, these foods there, they are high in salt, they are high in fat, they are high in sugar, but we enjoy consuming them. Physical inactivity is another risk factor. In Nigeria, if people are getting affluent, one of the evidences is that we have all manner of servants around us. We don't move anymore. We don't do anything anymore. Everybody, all those people do everything for us. So we sit in one place. We don't move. We don't burn calories. Everything we eat stays with us. And, you know, blood sugar begins to rise, blood pressure begins to rise. So alcohol is a risk factor for hypertension. Stress, like he mentioned, of course, we know how much, and you know, when we are exposed to stress, there are hormones in our body, chemicals in our body we call stress. They are meant to help us handle challenges on the immediate, and that's it. But you see, when we have persistent stress and these hormones remain up there, of course blood pressure will rise, among other debilitating effects of stress hormones. And lack of sleep is also a risk factor. So ideally, for brain hygiene, we need to have 7-9 hours sleep per day. That's what is right for the brain. So when we don't have good sleep, the stress hormones are up there, blood pressure will rise. Smoking is a risk factor for blood pressure. And of course, these days, we have a big challenge among young people because we are beginning to see blood pressure among young people. We are beginning to see heart attacks among young people. Why? Because they are on these drugs, all manner of illicit drugs. They are also a reason for high blood pressure among young people.
What about pregnancy?
Well, yeah, pregnancy, when people are genetically predisposed, because there is a genetic component to blood pressure, apart from all these risk factors we are talking about, genetics is also a risk factor. That is why when a patient gets to hospital, we say, do you have hypertension in your family? So even though there is genetic predisposition, genetics will interact with environment for its final expression. So pregnancy, yes, blood pressure can rise in pregnancy, but usually at the end of pregnancy it should resolve. But if it doesn't, then it means that inherently that person is hypertensive and needs to look after the blood pressure.
All right, many thanks, Prof, for your opening comments and, you know, for letting us know the predisposing factors, you know, for hypertension. I'd like to get to Mr. Okonkwo now. I want to know what the early signs of hypertension are. It's a silent killer. Our professor, you know, spoke earlier and talked about the fact that many Nigerians are not even aware. So I'm thinking, is it that there are no signs at all?
Yeah, there are signs, but I will call them few because when those few things happen, all you do is to go to the hospital. For instance, when somebody is having chest pain right directly on your heart, it could be a sign. And sometimes it's not normally before you just start feeling dizzy, little thing, you are easily tired. You have to go to the hospital. Let me give you a scenario that happened sometime. I was called, a friend called, emergency. And I said, what is going on? They said, I should come. So we went there and we saw this friend. When we got to him, we discovered he was screaming that his eyes is trying to come out. His eyes is trying to come out. It's burst. What are we going to do? We're all laymen there. So we said, let's take him to the hospital. We rushed him to the hospital. By the time we got to the hospital, they began to check the vitals and then the doctor everybody was running, you know. And it's a public hospital. The attention was great. Eventually, after a while, the doctor called some of us and said, come. He cannot explain why this man is still alive. Because his systolic, that's the blood pressure on top, that one was over 200. He has never seen that. That's what the man told us. So they began to work on him, manage him. Eventually, the pressure began to come. That was the problem. It began to come down, After about a week, he was discharged. But the following week, he died at home. Yes, he died at home. So when we are talking about hypertension, there are several factors there, like already you've heard. And for us at the patient-led advocacy group, we are concerned about cost now, today. The cost we're talking about is that it is highly, for instance, you have your drugs and then at the normal government hospital, sometimes the drugs are not there. You are asked to go out and go and buy. And in those pharmacies, the drugs are very expensive. You have to make a choice, either to buy your drug or to get food for your family. Eventually, the food wins, and you skip the drug. You can imagine what happens. And so these are things. And then we know in this country, our country, some people say a lot of things here and there, but I can tell you I've seen a lot of improvement. Number one, in the 80s, 90s, we had only 6 killer diseases in this country. But today, we have over 14 vaccine-preventable diseases that we are preventing our children under 5. That's a great thing. Check up, you see what I'm telling you. And in this same country, HIV/AIDS is free. In this same country, treatment for TB is free. I told somebody yesterday, are you aware that this? He told me he's not aware. So, but that is the truth. In government hospitals, they are free. Why not SCD? Especially hypertension. With all that we're hearing, the level is not a joking thing. And some people now, they are becoming hopeless. You spend your money, you sell all you have. You keep on selling until there is nothing more to sell. And then you are left to suffer and die alone.
You know, you talked about costs being the reason people stop taking medications. Some people also say that the fact that you're dependent on the medications for life is also a reason to stay away from the drugs. Prof, you want to explain that to us? You want to is it possible to be on medication for hypertension and eventually be free from it, or is it that it's a lifelong treatment?
From what I know, it is a lifelong treatment. It is possible that, you know, with lifestyle changes, really intentional lifestyle changes, behavioral changes, that at some point it could stabilize, you know. But if you either still are exposed to stressful, you know, situations, if you continue to take food that is not appropriate, you continue to take alcohol excessively, you continue to smoke, you know, and then there are these power drinks, you know, that a lot of people take. Energy drinks. Thank you. Energy drinks. Your BP is likely to remain high. And then what you then do every time is to continue to take, you know, those drugs that take daily to bring it down. But I think that with a very stringent diet, a very focused, you know, lifestyle in terms of exercises, in terms of the way you respond to issues rather than react, you know, you can actually help yourself to bring down your BP.
Thank you very much, Prof. Let me get to Nanlopo Breke in Lagos. I'm sure you've had the privilege of listening to the guests in the studio, and I'm wondering, what does the rising burden of hypertension in Nigeria mean for Nigeria's public health priorities?
Thank you very much. I mean, it has already been said that non-communicable diseases are underfunded, and that also includes hypertension. A lot of resources have been channeled to health security, especially during COVID, infectious diseases, like even for HIV, and neglecting cancers, neglecting diseases, cardiovascular diseases that come as a result of hypertension. But I would also like to say that I want to also mention that while the burden for hypertension is very, very significant, we know that the after effects of hypertension is mostly linked to high sodium intake. There's also trans fatty acids in the oils that we also use. So cooking and the kind of food we consume is high on the radar. In Nigeria today, the sodium consumption is very high, and that is of is a concern. The government needs to put in place certain policies. I dare say that there are policies already. I think 2 years ago we had a number of policies, even around building the capacity of healthcare workers at the primary healthcare level to provide first-line services for uncomplicated hypertension. I want to emphasize on that. It's uncomplicated hypertension, because I know Prof is also in the room and she's aware of this. We've been partnering with other research institutes like the University of Abuja to make sure that we're using evidence to support the framing of these policies. And it's one thing to have a policy, it's another to implement it. So for Resolve to Save Lives, which is the organization I work with, I would say we're the forerunners of advocating for and ensuring that hypertension services are provided at primary healthcare centers. And the government has a part to play, because we've been partnering with the Federal Ministry of Health, and the NCD division has been championing the National Control Health Initiative in Kano and in Ogun states where the pilots. So there is progress, because even the government has been able to take on with evidence that it was 0% when we started in 2020, just to highlight that hypertension blood pressure control rates was at 0%. And I can say it took a long time to actually even put those policies in place and ensure its implementation. And even the protocol for administering treatment of hypertension in PHCs was a sticky point that we had to navigate, even with the practitioners and the medical cardiologists. There was some pushback also from health professionals as well. But we all were able to come to a consensus, and now we have treatment also provided. So in essence, the government has a very significant place, because we have to make sure that there's the available funding. We've seen that happen in Kano State. We're seeing that happen in Ogun, because they're using what you call the Basic Healthcare Provision Fund and making medicines available so people don't have to deal with out-of-pocket expenditure. But it was, we had to make sure that hypertension medications were even included in the essential medicines list to even get that to be implemented at primary healthcare centers. So, yes, government has, but there's a lot has already been said by my colleagues on the, talking about individual responsibility, changing lifestyle, and ensuring that our consumption of healthy foods and exercise is important. So, yes. Funding is very, very important. Not only just making sure that there's allocation actually, but also the disbursement and the utilization of these resources for hypertension prevention. And some work is being happening, at least at state level. The states we've worked and in other states, they're taking this on board. And even scaling up from the initial pilot sites, like Kano, for instance, has gone to almost 300 or more facilities, with more coming on, providing even the BP monitors to even check our blood pressure. It's expensive. Not many people can afford it, and of course we talked about the medicine, but local manufacturing of these medicines brings down the costs down, and we know that there's already an agenda by the government to put this, to make this to capacity in such a way that it reduces the cost of medication.
Many thanks, Nanlop. I heard you talk about funding a number of times, and funding, of course, the direction is always to government, how government can fund better. But Professor Anuma, my question to you would be, should we be funding to manage hypertension, or should we be funding to prevent hypertension? I mean, when Prof talked earlier, he talked about pressure of life. I mean, the economic factors, you know, all those other factors, you know, that could lead someone into stress and, of course, lead to hypertension. Should we be dealing with those factors, really? Or should we be now talking about funding to get drugs available? Or, I mean, is it that we want people to get to hypertension and then take care of them, or we want to stop them from getting to that point?
Okay, thank you very much for this question. Before I answer it, I just want to make a statement that hypertension largely is symptomless. People are hypertensive, they have no idea. Some of the signs he had mentioned, they are complications of hypertension that has been there for 10, 15, 20 years that the individual didn't know about. Okay, so it's very important, and that goes to really emphasize the importance of checking your blood. Every occasion you have to get to the hospital, even if it's for malaria, blood pressure should be checked, blood sugar should be checked. In fact, that's what the Federal Ministry of Health is advocating. Any contact of any individual with a health center, with anything called health facility, blood pressure should be checked, because you never know.
But that's done usually, but blood sugar is a bit more complicated.
No, blood sugar should also be checked. That is part of the advocacy. Every occasion to step into a hospital, blood sugar must be checked. Actually, the Federal Ministry of Health, the Non-Communicable Disease Division, they've gone far in making sure that that equipment, the glucometer, to check blood sugar is made available at even the primary healthcare centers. That effort is ongoing right now, so that you can check, because diabetes and hypertension, they are like siblings, dangerous siblings that exist together. Okay, so blood pressure can start first, eventually blood sugar will show up, or blood sugar shows up first and then blood pressure shows up, and the two are deadly combinations, and that's why we have to put an eye on these two. Now, I say in Nigeria, from the structure we have, we run essentially an out-of-pocket system, where the truth is, if you don't have cash in your hand, you can hardly access quality health. Yes, we are happy with the basic healthcare provision fund, but it's not really operating at the level that we expect for the common Nigerian, the ordinary Nigerian, to be able to access quality health. In this kind of situation, the best option that we have, the cheapest option that we have, is prevention. So we need to put resources in prevention, because that is the cheapest option. If an individual develops kidney failure from hypertension in Nigeria, that is a death sentence on the forehead of that person, because the whole family initially will contribute money for dialysis. After some time, you see that resources begin to wane, and therefore the person does not appear anymore for dialysis. And after a while, is that the whole family gives up, and the person is just waiting for that day that the whole thing will end. So that is what it is, and that is why I keep emphasizing the cheapest option is prevention in our setting, in the structure we run. And therefore, people need to look at these risk factors we are mentioning, because Nigerians are not listening to this risk. If a family, if a parent has hypertension, then the children of that person, they have a risk. They need to know, do what is right to prevent having it. Because gene expression, like I said, will interact with environment for its final expression. And what is the environment in this instance? It's our lifestyle, the way we live. We can live to be alive. We can also live not to be alive by the way we live. And so it's important to pay attention. People who take alcohol heavily, they need to step down. Salt intake, our colleague online said it, and studies have been done to show that our salt consumption in this country, in every food, is so much. We need to step down salt intake. We need to begin to be physically active, because excess weight on its own can bring blood pressure without a family history. So if there's a family history and that person allows excess weight, then these are two reasons why that individual will quickly become hypertensive. we need to look at our weight, because God is a perfect scientist. The way he made us, there is an ideal weight for every height. Once you allow your weight, once you allow your weight to get beyond what that height is meant to carry, that is the beginning of hypertension. That's the beginning of diabetes. So people, but in Nigeria, we have things, cultures that are counterproductive to preventing NCDs, including hypertension. Why? Because we respect weight. When you don't have weight, it's like you are suffering. When you have weight, everybody sees you as, oh, life is good. Man. You are enjoying, you are a big man. And we love it. And therefore, we are not about to begin to make attempts to lose weight. We resist it. That's the point.
There are some misconceptions about hypertension, or if you like, high blood pressure.
Yeah.
You know, some say that, you know, that machine you're talking about, the device, it's just a manipulation to get people dependent on drugs. You know, I even heard a preacher, you know, say that, you know, on a video clip, you know, saying that, well, it's, I don't know, speak to us about some of these misconceptions. You know, some people will tell you, well, my parents never had to check their blood pressure. They lived till 90, whatever. I mean, he was always on the farm. He was always working. He never slept 7 hours or 8 hours.
So you go on the farm. So you also go, you should go and farm like your parents did, you know. So when you finish that heavy bowl of pounded yam, and very spicy.
Pounded yam, ice cream. I think you should say ice cream.
Or ice cream. Then go and sweat it out. Go to the farm, find something to do instead of, you know, living a sedentary lifestyle, which a lot of Nigerians, you know, are sort of prone to and are used to now. And I want to also lend my voice to the issue of funding. Certainly, prevention is, of course, better than cure. And I can tell you that the Non-Communicable Diseases Division of the Federal Ministry of Health did not receive 10 kobo release for 2025 budget. Okay? That is a huge issue. The second thing I'd like to talk about is even the policy. In terms of policy implementation, the multi-sectoral action plan on non-communicable diseases, the one that just ended 2019 to 2025 in December, rate of implementation was only 10%. You have like ongoing activities, you know, that are really not clearly defined, 51%, and not even touched at all, 39%. That's the situation that we have right now, you know. And I think that in as much as there are competing priorities, we really want the federal government to fund Federal Ministry of Health, you know, better, and to prioritize preventive activities in terms of hypertension and other NCDs. That's what I would like
preventive
to add.
Activities like what with the Federal Ministry of Health?
Oh, there's so many. Oh, and thank you very much. So we have a multi-sectoral approach. That means that different ministries, departments, and agencies are involved, are part of it. So education, the Ministry of Education needs to ensure that in the curriculum, you know, and so the Ministry of Education really must have a budget to ensure that, you know, children in school are really educated. Ministry of Environment has a role to play. Ministry of Agriculture, you know, so all these different ministries, you know, Ministry of Sports Development. Now, all these have activities in terms of education, in terms of the necessary, you know, tools, in terms of equipment to ensure that Nigerians really...
Go ahead.
So, yeah, so it's multi-sectoral. So health promotion to get, you know, people in communities to really ensure that they know what they're supposed to do, what they're not supposed to do. When you visit the primary health care centers, the healthcare workers there should routinely, you know, talk to patients that walk in about these issues. And then we also need the traditional institution, religious institutions to be engaged, you know. So it's a kind of whole of society approach that will take.
To ask you at this point, if the Federal Ministry of Health understands all of this itself, because we've heard reports of doctors, you know, as a result of work pressure, also getting complications like this, high blood pressure, you know. So I'm saying, if the Federal Ministry of Health, or if you like, doctors who should know, are being overworked, and sometimes you go to the theater, you hear there's this brand of drink they take all the time when they have to work for long hours. I don't need to mention that on air, you know, doctor. I know the brand too, because I get to hear them talk about it a lot. So you ask the health professionals themselves, are they setting a good example, you know, for the patients that, you know, they talk about in terms of managing blood pressure and hypertension eventually?
Prof, you work in a tertiary institution, so maybe you want to respond to that.
Well, you see, when we have a health situation, we talk of government responsibilities, we also talk of individual responsibilities. So even though the government, yes, they have responsibilities towards the citizens, they need to do more, they need to invest more, both in preventive strategies and in management. The individual, him or herself, also has his responsibilities. If somebody is hypertensive and is on medication and is not compliant with the medications, despite counseling and encouragement to change behavior, what can you do? Complications will come, because we're still individuals, even though we're under the umbrella of government. So I think what we need to do is to do more. Empowering the patient is so important. Empowering the patient. In fact, what I tell patients is, it's our responsibility to empower you to understand the disease fully and know what my own responsibilities are to you as your doctor, and what your own responsibilities are to you as your own doctor, really. Because if the patient is empowered enough, he is his own doctor 50%, then I take care of the rest 50%. So there's a lot we need to do, both for ourselves and for our patients.
All right, thank you, Professor. Let me welcome down in the studio Dr. Ahmed Sani Bala. He's of the Department of Family Medicine at the FMC Abuja. He's also CEO, Vital Aid Medical Foundation. Thank you for joining us again on the program.
Thank you very much for having me. Good morning.
All right, while you catch your breath, let me get to Francis. And I'm asking, what are the biggest, from the patient's perspective now, what are the biggest challenges that patients have living with hypertension?
One of the biggest challenges, just like it has been greatly emphasized, is the cost. It's still the cost. It's still the cost, out-of-pocket cost. Like I said, sometimes, it's not always, sometimes going to the clinic and the drugs you are asked to take is not there. And then you have to go outside to pay for it. Buy it, like I said, you may have to decide what, because the cost within the hospital setting and outside is not the same. And so we have that concern. And also, like we have said, the challenge again also, apart from the drugs, and then there also is understanding that this drug is a lifetime journey. It's a lifetime journey. It is, I call it myself, a journey that has no end. And as much as possible, like we have said, prevention, our youths who are being prevented from communicable diseases should not be exposed to non-communicable diseases. If we don't do something about that now, that's what will eventually happen. There are things we have to do. The NOA has to be, because I know a lot of people, they are even afraid. There's no real reason to go to the hospital. They are afraid to go and check. They are afraid. Many have said it a lot of time. We had a meeting somewhere, and then we had about 100 people that came for that meeting. And eventually, there was a need to check for the BP. Over 44%. We are all having elevated blood pressure. So you can see what is happening. People are afraid. So there's a need for emphasis on, you know, on the government, on the partners, because all these things we are talking about, the issue of funding, is not only the government, the partners who are supporting when you come to communicable diseases. Why not non-communicable diseases?
All right, many thanks. Let's get to Nanlop. And Nanlop, I would like to find out if ignorance is bliss in the case of hypertension. You know, some people say it's better not to know the numbers. That your blood pressure will be lower when you don't know that your blood pressure is high. I don't know. Just explain that to me, really. If it's actually okay to live in ignorance or or in denial that your numbers are high. Then speak about workplace. I initially asked a question about doctors because I know 2 doctors who actually died as a result of high blood pressure and as a result of pressure from work, right? Having to operate people in the theater for so many hours without any relief. Eventually 2, I know, at different times passed on as a result of that. So tell us what workplace, what kind of thing can come in place for workplace so that it can help people who are managing this condition, just so that they do not get some complications or eventually die as a result of it.
Yeah, so ignorance is definitely not bliss. But the ignorance might be that because it's, of course, we know that hypertension doesn't have any symptoms. People don't get to know that they have hypertension because it doesn't present like you have other infectious diseases or you have some other ailment. And the only way to know is when we regularly check our blood pressure. If we can, for those who can afford it, I can also share a personal story. I'm somebody who's living with hypertension. This morning I've taken 10 milligrams of the pill. At one point it was controlled to a point where I was asked to reduce it to 5 milligrams and it went up. And that speaks to the stressors that happen. The work that we do usually requires, it facilitates or it's more sedentary because we sit for many hours. Or we, like you mentioned, the example of the doctors who have to operate, or there are different people in the work environment or the work people who are working. There is a lot that goes on that can trigger stress. So not only for that, I think it has been already established that it's all over. So it's not ignorance is not bliss. We have to get screened. And I do not think that screening, it should ideally it should be routine. And the professor can also attest to this. In any health facility, the first part of your, your vital signs includes taking your blood pressure. That's in the hospital environment. But even at home, people should be educated on how to check their blood pressure, especially if they're predisposed to it. So definitely ignorance is in place. The data after that, what happens after that, there's already a protocol that also provides guidance on when the reading is taken. At what was the threshold? At what point do you need to see, do you understand that actually this is already, your blood pressure is elevated and needs to be controlled? So that is where the prevention comes in, increasing knowledge and encouraging behavior change across populations. So yes, when it now comes to ensuring that we practice what we preach, looking specifically at partners and every other person who is either exposed to it or is not aware of it, then those are the things that need to be addressed in the workplace. There are certain workplace policies that have been put in place to support or to kind of it depends on which sector that one is working. Some are better than others in addressing issues. It touches also on mental health when you talk about stress. And I'm sure Professor Al-Hassan can speak to that as well. Yeah, so it's never, you have to do that screening. We have to keep pushing for healthy lifestyle promotion. Intermittently, one of the things that I also practice is if you sit for a number of hours, you stand up. It's almost like it's a 10-minute rule. You move about for a bit, come back and sit. Some other careers or professions in some cases will not allow you to do those, have those breaks. But it's possible to weave in active or exercises or different ways in which one can actually increase movement. But diet is very important. If we are on our medication, because what has already been established is that yes, prevention is important, but the management is also important. So what we advocate for is to ensure that medicine, there's access to medicines, quality medicines at affordable costs for those who have to deal with out-of-pocket expenditure. But it's relative, and there's studies on affordability for of medicines, and even the willingness to be able to know that you have high blood pressure, or even the willingness to change behavior to actually be consistent in taking our medication, so that we don't have complications down the line. But I also want to add my voice to what has also been said in the room about the role of the government. We talk a lot about funding, but it's important to unpack it. But on the funding side and also on the policy side, it's very important. It's good to have great policies. We're known to have, as a country, multiple policies. But how do we implement those policies? The implementation, even making sure that, because we have a federated system, so we can keep looking to the federal, but we also need to look at the state level. So there is also a responsibility there to domesticate these policies and ensure that they're implemented fully. We have the STEP survey. For how many years we've been pushing for it to be validated? Thankfully, maybe by June, it will be validated and cleared and ready for use, because there's so much data that can help to shape these interventions that we've been talking about during this during our discussion.
Thank you, Nanlop. Now, let me get to Dr. Sani Bala. Welcome to the conversation, by the way.
Thank you very much.
Now, at what point should individuals begin routine blood pressure checks?
Thank you very much for the question. So we advocate for routine checks for blood pressure and other non-communicable diseases. There are steps that we do. So for every adult, we encourage routine screenings. However, there are people that are more at risk, so we encourage them to start earlier. Example, now you have an 18-year-old person, he's an adult and he has a family history of hypertension, he's obese, and then maybe he has some other conditions that predispose him to hypertension. So we encourage early and more frequent screening than other people, but generally we encourage screening to start as early as possible in adulthood, and we take the advocacy down to different levels. From university level, we go and do health talks to them, we go to different workplaces and do health talks to them, because these diseases, they are silent, especially hypertension that we are talking about. Sometimes by the time it's presenting with the symptoms, complications are already setting in. So you only know when you do the screening. So the screening, any adult greater than 18 years and above. And then we can also do the screening in people younger than 18 years when they have family history, when they have other diseases that can predispose them to having what is called secondary hypertension. So you can be screening them also regularly. So any adult, and then anybody less than 18 years also that is not an adult but has some history that is predisposing, or some conditions that is predisposing the person to having hypertension. So you keep a close eye and then you screen regularly. But from
regularly, every month, every 3 months?
So it depends on the condition that the person is having, and then the symptoms we are having. You individualize it to the particular symptom the person is having, and then the particular comorbidity that would predispose the person to hypertension. So you individualize it. There are different people, like there are children that are morbidly obese, and then it predisposes them, even if they are less than 18 years, maybe 16, 15 years, you have to be checking their blood pressure regularly. And then once you see the blood pressure pattern, it would inform you on how regular, because we have home blood pressure monitoring, and then we also have the blood pressure that they check when they come to the hospital. So we encourage both the home blood pressure checks and then office blood pressure checks, and then when they present to the hospital also. So any adult greater than 18 years and any child that you think has any, by your diagnosis or his clinical history and symptomatology, and then other comorbidities that you think would have hypertension as a result of other causes, or his lifestyle, then it will predispose him to having hypertension. Regular screening is advocated for. And any adult, wherever the adult is, at work, in the schools, within the hospitals, or any other place, screenings are key in diagnosis of hypertension, because it's through screening that you'll be able to pick out the hypertension.
Now, for a lot of people who probably feel they are in the clear,
yes,
when you enumerate all of this, check here, check at home, check at work, check in the hospital, it becomes a handful. So let's talk a bit again about prevention.
Yes.
What simple daily habits will you propose that can help reduce the risk of developing hypertension?
Thank you very much for that, because as we know, prevention is better and cheaper than cure. So we are advocating for preventive medicine, and then lifestyle medicine from the family physician's perspective plays a key role in the prevention of hypertension, because there's a diagram that I recall vividly. It's a patient going on a pathway, and then there is a crossroad. Here you see different drugs and different medications. On the other side, you see vegetables, you see exercise, you see healthy diet, you see sleep. So it's left for you to choose between healthy lifestyle and then curative medicine. So I tend to tilt towards the preventive medicine through lifestyle. So we have some major components in lifestyle medicine, starting from the nutrition. We are all products of what we eat and what we ingest. So there are foods that you eat that are not healthy at all, and they will predispose you to having complications and then non-communicable diseases and all the sequel of diseases that would follow. So nutrition and diet is very, very important, especially for people that are aging greater than 40 and all. But we advocate for that even for any other person. We do health promotion once you visit the clinic and at every opportunity. You eat healthy. What we mean by healthy, a healthy balanced diet that has an adequate serving of fruits, vegetables, and then carbohydrate at appropriate portion, and then all the components of food at appropriate portion. Your healthcare giver would guide you on how to make that, because a plate is supposed to have all of these components of food at appropriate. But
that's not also cheap, because when you talk about the cost of medication, you talk about fruits and you talk fruits, vegetables, balanced diet all in one plate. For a lot of people, that's not cheap.
I think I would say it's cheap, because Nigeria is blessed with vegetables, we are blessed with fruit and all. So different components of, when I say proteins, when I say you mustn't have a big portion of chicken and all that. There are nutritional foods that are highly proteinous, and then we have beans. Yeah, thank you very much, sir. Beans, you can have beans, you can have the legumes. They have protein content. They have high protein content, and then we also have abundance of vegetables within our disposal. So you individualize it to what the person is. Like if you are counseling a person from the northern part of Nigeria, you know the particular type of food that would avail protein, vegetables, and all in one setting. And then if you are counseling another person in the southern part of Nigeria, you know what to tell the person to eat that is available within their locality. So you individualize the counseling. Is not one distance for everybody. You know, you individualize it to everybody. So you know how to the important thing is just to eat healthy, and then exercise. We advocate for according to the age of the person. The exercise that an 18-year-old would do or a 20-year-old would differ from the one that a 60 to 65-year-old would do. So you individualize your counseling, but the most important thing is for the person to do adequate exercise, moderate intensity exercise within the week. It goes a long way in prevention. And then sleep also. You tell the person the appropriate number of hours to sleep. 7 to 9 hours. According to the age group, we have different hours of sleep that is recommended. And then also in coping with stressors, how to navigate around work. As Dr. rightfully said that joined us, even the work environment also, some works predispose us to sedentary lifestyles. You have long stretch of hours sitting down. So by the time you calculate the number of steps in a day as recommended by the World Health Organization, you would see that even as a healthcare worker, you have to be very, very careful and deliberate about that. Like, let me take myself an example. We sit in the general outpatient clinics, and then we sit and see patients. So as my prof rightfully said, it's individualized. You have to make an effort as an individual. So sometimes I deliberately come out of the clinics, walk around, call the patients, arrange the patients and all that, so that you'll be able to have those number of steps rather than sitting in a long stretch of hours. After 2 hours, you stand up, walk, stretch, exercise, and come back. So whichever work you are doing is your health first. That's prime. You have to be healthy to do that work. So at least some hours of break in between work to help, because there are people that are morbidly obese and all that. Even their circulation, it predisposes them, apart from hypertension, other diseases that could result from prolonged sitting. So I also advocate, even within the work also, you exercise, and then you stretch in between the prolonged sitting hours. And then smoking is also implicated in hypertension as much as possible, and alcohol. And then now the rule is there is no healthy amount of alcohol. So as much as possible, you avoid alcohol, you avoid smoking, because they are highly implicated in the pathophysiology of hypertension. So with these lifestyle changes, they will go a long way in preventive in prevention of coming down with hypertension. And then in the people that are already hypertensive, by adhering to this lifestyle now, it's multidisciplinary approach in that you don't just take drugs and then you abandon the other components of your treatment. So lifestyle, diet, exercise and all that alongside with the treatment, they go a long way in reducing the morbidity and mortality.
Thank you, Dr. Bala.
And if I may just add, from a psychological point of view, in simple language, don't kill yourself. Whatever issues that you have, if you're not alive, and number two, healthy, you can't even work or go out there to make money to solve the issues of, the people back home you need to send money to, or that thing you want to do and all of that. The other thing is, please do not compare yourselves with others. And part of the issues with young people is social media. Somebody goes and poses with a car, a young person, and then makes it look like it's theirs. And then you are sitting here and you're thinking, oh, look at my age mate. So a lot of these things are things that are purely the way you internalize and the way you perceive and the way you respond. So I want to appeal to Nigerians to really, really take care of their health, sleep adequately, stop worrying and fretting over things. Even if you have issues, that issue, you wake up tomorrow, that thing that was a problem yesterday, would just find a way of resolving. And if you can't resolve it, then just accept that is it and move on. So
thinking really elevates blood pressure. Because all we've talked about here are lifestyle choices.
Yes.
Thinking, you are worrying, you can't sleep. Or you sleep and suddenly you wake up because there are some things in your mind. You are thinking about the school fees. You are thinking about, look, the world is not going to come to an end. If you can't deal with it today, it simply means you can't deal with it today. So just go and sleep. And tomorrow, you try again. So that's overthinking things is also a killer. And that's why, anxiety, stress, are things that we really advocate that people should do everything within their power, to avoid.
Just when you said stress, I'm thinking for those who work in environments where you are supposed to deliver certain hours of work, what do? You don't have a choice. You have to be at work, right? So, that's a main issue. So maybe there should be laws as to the number of hours people should work. I
have a friend and a former classmate who worked in the bank, years ago, and it was, I think, Easter holiday. He traveled out of Lagos somewhere to play golf, and the chairman of the bank called him that there was an emergency. He said, "Sir, with all due respect, today is a holiday, sir."
Not everybody can say that. Yeah. Maybe we should take a break at this point.
Okay.
We should take a break at this point. Okay. Yeah, let's take a break. We also need to relax here. Stay with us. All right, many thanks for staying with us. It's still Good Morning Nigeria right here on the NTA, and our guests are still very much with us. We have quite a number of messages, and maybe we should read them. But there was a question on my mind before we went on that break, and that question is if herbs. I've heard a lot of people talk about, if you take the tree of these, or if the leaves of these and all that, if that can help hypertension. Professor Alhassan, that's a question I would like you to respond to. If away from the normal medication we're giving at the hospital, if other things in our environment can deal with, hypertension. But let's read the questions we have here. This one is from Ahmed Baba Dikwa from Maiduguri. Hypertension often flies under the radar with no obvious symptoms, but over time it silently distresses your heart, brain, and kidneys. The good news, small, consistent changes like cutting back on salt, staying active, and managing stress can make a big difference. Don't wait for warning signs. Check your numbers regularly. Thank you. This one says, good morning, Nigeria. Good morning, presenters and your guests in the studio. As a layman, hypertension is a sickness that affects mostly elderly persons, including some young people. I also believe the only way to cure or manage hypertension and other diseases is to make sure people visit hospitals for medical checkup and avoid self-medication. That's from Alaji Garko in Karo site, Abuja. Thank you very much, Alaji. This one says, good morning. There are claims on social media by traditional medicine practitioners that they have permanent cure to hypertension, calling on those with hypertension to abandon their medication for traditional. What is the implication, and how can NAFDAC and government come in to verify such claims? That's from Musa Muda from Maiduguri. Another one says, good morning. Complications leading to stroke, kidney and heart failure are everywhere within the society. Why is it so? And how can one ensure hypertension does not lead to stroke or organ failure? That's Zainab Ibrahim from Kaduna. This one says, I'm Pastor Ajose Emmanuel from Ukwedu, Lagos State. Hypertension is very bad. It's mainly caused by stress, overworking. Let's tell our teaming youths to stop overworking. All right. All right. Thank you so much, Pastor Emmanuel. Another one says, good morning, Nigeria. Please, what can we use to substitute salt and Maggi in Nigerian soup? I mean, you mean seasoning, you know, Maggi is a brand. Mr. Sam from Kogi, Nigeria, Kuta. Thank you. Another one says, I'm very happy about the health discussion on hypertension this morning. My name is Joseph Ugiagbe. I'm a medical radiographer in Irua Specialist Teaching Hospital, Edo State. I'd like to say sensitization and public awareness is poor. There should be jingles in the market, free checks at the market square, etc. Access to healthcare is expensive. In fact, healthcare should be prioritized in government plans. Thank you very much, Joseph, for your message. Another one says, good morning all. NTA, you are doing great. Today's topic is very important. Thanks to the results persons. My BP is between 118 and 68 and 119 and 68. Should I still continue with my medication? Hadia from Edo, thank you. All right, doctors, I'm sure you want to respond. So maybe we should begin with Professor Hala Hassan. You go, and then.
Thank you very much. Talking about herbs, and before I respond to that, I just wanted to quickly say that in response to the question you asked before the break, not a lot of people, or not many people, can tell their bosses, you know, please, I can't make it, or, you know. I think one of the things we need to teach children and younger people, and even adults, is this social skills, to be able to explain yourself and to take excuse in a respectful manner. It's important, very, very important, that you're able to navigate and not engage in work overload, and then you get sick, and then because the day you drop dead, sometimes within hours, depending on the profession, depending on the skills that you have, you'll be replaced. Within days or weeks, you'll be replaced. I just wanted to, so it's important for us to develop those skills to be able to really negotiate the things and have safe spaces, you know, for ourselves. Traditional medicine, we know that, you know, growing up, there were, you know, herbs routinely sometimes, you know, things like dogonyaro, you know, and so on and so forth. The moringa, very, very nice. And for others, you know, sasso, you know, leaves, you boil it and all of that. And I'm very happy that the Federal Ministry of Health has a department that looks into that. And I think the most important thing, and recently I spoke with a professor at the University of Benin who really is into looking at herbs, the ingredients, and then he can tell you, you know, the formulas to use and all of that. So there is a scientific way of, and I think that the relevant agencies, like somebody mentioned NAFDAC and all of that, we also have NIPRIT and so on. So if you have herbal solutions, take it to the appropriate, you know, so that it can be checked. And I share that I even know somebody who exports organic herbal medications to the United States of America as we speak, you know, because she works with scientists who provide, you know, the formula and all of that, and these things are rigorously checked. So herbal solutions are things that also can be used for hypertension and other diseases, but there's a need for fact-checking them and also for regulation. That would be my response to that.
All right. Thank you very much, Prof. We have some more messages, quite a number of them. And I'll begin from this end with Abdullahi Ladan, who is writing in from Lafia, Nasarawa State. Good morning. On a daily basis, we are awash with adverts on series of medications of hypertension, especially in the social media, with some said to be fake. What steps are medical experts, NAFDAC, and other relevant agencies taking to curtail such excesses, given the fact that most of these advertised products are fake? I wish we had the NAFDAC person here. This other one is from Ibrahim Bu. How can one ensure his or her blood pressure is always on the safe margin? All right. Another one from Muhammad Awa Musa Famai in Kanu. How far is the nearest health facility for regular blood pressure checks? And is the cost of transportation a major barrier? 2, do primary health centers in our areas have enough working blood pressure apparatus and trained personnel? And finally from him, can we improve training for local community health workers to ensure they can accurately measure and manage blood pressure? Thank you. And from Yusuf Abdul in Zaria, hypertension awareness program is still low. There are a lot of misconceptions about hypertension, and questionable claims of effective alternative traditional herbs are very common. This is why many people are reporting for hospital treatment when complications already arise. So we need to step up preventive health programs. From Haja in Edo, I think you read something from her, so I skip. Ade, good morning, Nigeria. This is a good topic. The cost of managing hypertension is the major challenge. I want to be specific on retirees, as hypertension is more pronounced with age. The NHIA is designed to allow those working to enjoy healthcare services. A retiree is removed from the list the day he retires. What can the government do to help alleviate the challenge for the senior citizens who need medication more? And finally, from Salawu Yakubu, thank you for discussing hypertension this morning. I am 40 years old and I've had hypertension for 10 years. I take medication, and when I take it, my BP drops from 170 to 100, or from 170/100 to around 150/90. But when I can't afford the drugs and miss doses, it goes back up to 172/100. Please, what should I do? And he's writing from Lagos State. Now, let me get to Prof here to just respond quickly so that we can still do a tour round before we shut down.
Thank you very much. Yes, one thing I want to say, one statement is that we don't cure hypertension. We control hypertension. That's what we do. So we don't claim to cure, we control. Now, you mentioned something, that somebody's blood pressure is taking drugs and it became 110/80 or 110/70. Should the person stop medication? My answer is no.
But it doesn't have the
It is the medication that brought that blood pressure to that level. What can be done if blood pressure remains that way? The dose can be adjusted, but that individual cannot stop. That's why we don't claim to cure hypertension. We control hypertension so that that individual can live his or her normal life. I'll say that. Then the issue of herbs. Yes, we may have herbs that can do things, but you see, before you see a drug at the counter in the pharmacy, that drug has passed through what we call phases of clinical trial, and there are 4 or 5 phases of clinical trial, because you start with you get a substance. You start with an animal, put it in this animal and see how is the response. If it kills that animal, that's the end of that substance. If it does what it's meant to do, but the effects are still quite toxic, that's the end. So there is a process up to when human trials are done, and even what we call post-marketing trial.
So the challenge with our
with our own herbs, they have not passed through this.
Why are we not doing that? Why are we not putting effort in?
Well, let me tell you that in the US, for example, they spend billions of dollars to do clinical trials before you find the substance out. That is why when a drug comes out new, it's very expensive. There's what we call patency period, because the company that has invested, they need to recoup their money before, you know, you have generics. It's a very expensive venture. Do we have the capacity? That's the question. Then another part of it is this. Nigerians are quite secretive. Some of the people who are, you know, who make the herbs, they are not ready to reveal the secret to nobody. And if you are not ready to reveal the secret, how do we study that drug? So these are the two challenges we have concerning our own herbs.
All right. Well, thank you. Let's quickly get to Lagos before we come back to the studio for the others. Now, I'm wondering if you have first response to any of the questions that have been raised, quite a lot of them.
Let me start with the last comment from my colleague. Even WHO has a traditional medicine strategy. So there's a recognition for traditional or alternative medicine. But the importance is making sure that regulation is part of that. The science, like she's also mentioned, so added to that, the science is very important. So the clinical trials is also part of that process. So it doesn't mean that it's still work in progress. So we can't sit here and prescribe and say that for hypertension, these are the alternatives to take. But of course, it is recognized and acknowledged that there are alternative medicine. There's alternative medicines, but it has to go through that process. The second, there were comments on really great comments that came from our listeners. One is the importance of screening and going through regular hospital checks. We don't have that culture. It's safe to say that we do not have that culture as a country, as a people. Having those regular checks, for whatever reason, we can spend a lot of time talking about the behavioral, the social reasons why people do not present at hospitals. But the focus is it is important to do, and the vital signs are important to be taken. Thirdly, when you do screening, it shouldn't end with screening, because the data has to be captured. We have some data, but it doesn't tell us clearly to what extent we have control rates. And so if the people are screened and we find that even the conditions of screening routinely is important. We have swigs, we take our blood pressure. You're supposed to be in a certain position to take when there's a high client rate, it's almost done hurriedly. You can have incorrect readings. So we do not want to misdiagnose people. And it is over a period of time. There's a number of checks that will be done to ascertain it. And we have follow-up visits. And that is why having it done during routine checks and having people, even you can actually take a step back. And if you check the blood pressure, you come back after you've kind of rested. And usually I'm told we do it in the morning. When I wake up in the morning, I have my apparatus. So there are things that one can do. Like I said, we don't want to talk about this. I don't want to delve too much into the socioeconomic dimensions and limitations of why or why not we can't check this. So those routine checks are important. Vital signs are part and parcel, ideally should be, of any presentation at the hospital. And when screening is done, there should be treatment immediately or management. Once anyone is found to be, at least at the primary healthcare center, uncomplicated hypertension will be addressed at the primary healthcare center. We have proven concepts that it works. We have protocols that work. There's a lot of work and investment that has gone into providing, validated BP equipment or monitors, because there's so many out there out there. NAFDAC is on board with this and they're pushing. I know for Resolve to Save Lives as an organization, we also partner with NAFDAC, SON, and all those groups. So those comments are very important and they're correct. Finally, I would say that, medicines is a huge part of it, but data for decision is also important. We will continue to advocate for increased access to medications, but consistent use, as has been prescribed, is important. That goes to what Prof said, because the person who has started it shouldn't be stopping. You cannot start medication today, tomorrow you do not take it. Yes, we understand that people are concerned about a lifelong, taking the medicines, but it is important if you've been diagnosed with hypertension. Otherwise, the complications that come are even much more dire. So the dosage can be reevaluated over time, as has already been said, and that is important to note. I said earlier that I take 10 milligrams of amlodipine currently, but at some point, this is my own story. At one point, after lifestyle changes and everything, it was reduced, it was reevaluated, and I was asked to take 5 milligrams because my blood pressure was at a certain point. But it's not completely eliminated because it's a combination of lifestyle changes. So those are some of the things that I would respond to.
All right, many thanks, Nanlop. We need to round up the conversation now, and I'd like to get to Mr. Okonkwo. What would be your advice to people dealing with hypertension at this time? And those who do not have it, what would be your advice to them, just that they do not get to this point?
That's very, very important. For those who are dealing with hypertension, it's so important that we have to continue with our drugs. We know there are challenges, there are difficulties, but we have to continue with our drugs. And also, like I said, somebody may end up selling his car, selling his house, selling this. I also want to plead with the government. They've done it with HIV/AIDS, they've done it with TB treatments. They can do it also with hypertension. That is very, very possible. They should explore all possibilities with partners. They can do it. Sometimes it looks as if it was impossible, but it can be done. Then for those who have not started, that's a great one. It's a long journey. And so it's important that you don't get there. As much as possible, much has been said here today. If one is listening, then you have your life, your health in your hand. It's not somebody else that will do it for you. And so we have to take our own responsibility for our own health and for our own lives. There are things you've been doing, you have been enjoying, you've heard that this will put you into things that you will not be able to explain in your future.
Right.
Why not drop?
Thank you. Dr. Bala, your final words, please.
So my final word, I still advocate for prevention. Is better than cure and it's cheaper than cure. We outlined the lifestyle medicine, the components of lifestyle medicine. So very, very importantly, the things that are implicated in having hypertension, especially nutrition. You cut down on the salt, you incorporate fruits and vegetables, and then a healthy, balanced diet, and then exercise also. And then as most people said about the awareness also in terms of prevention, if we use the different sectoral collaboration, using the media at all levels, down to the grassroots, because that's where the awareness is minimal. In a language they understand, in means that is very, very relatable to them. If we can employ that also, it will be very, very important towards the prevention. And then the people that are hypertensive also, compliance to medication and the regular checks, and then being prompt with their follow-up visits, it will also reduce the morbidity and mortality we are having. All right, we need to wrap up. Professor Al-Hassan, the equipment for testing blood pressure, how do you guarantee that it's functioning optimally? Because, there are reports of people getting tested, the equipment reading different numbers. You go somewhere else and it seems everything is okay.
So, and that's why Nanlop talked about different readings. It's very, very, very important. And it's important to ensure that when you buy for personal use, you buy, what is recommended, so that you do not have false readings. And in terms of my final words, just two quick things. I've talked about the need for us as individuals to be able to train ourselves to cope and make sure you avoid stress, or you cope with stress as much as possible. And then from our advocacy point of view, the Global Health Advocacy Incubator and LISTEL, with other partners, advocating for sustainable funding for hypertension through all the various channels, and also that every stakeholder, including civil society organizations like the Health Sector Reform Coalition, need to support the Federal Ministry of Health in the development of the new MSAP.
All right.
And the new MSAP needs to be costed.
All right, thank you very much. Emmanuel Al-Hassan, Professor of Psychology at Nasarawa State University and Country Lead Global Health Advocacy. Many thanks for joining us, sir, for the conversation. We appreciate you for your time and your insight. Professor Felicia Numa, Executive Council Member, Nigerian Heart Foundation and NCD Alliance. Thank you very much, Prof, for joining us, of course. Professor Okonkwo, Member, NCD Patient Advocacy Working Group. Thank you very much, and I hope that your call is heard by the relevant government agencies and the needful is done. Dr. Ahmed Sani Bala, Department of Family Medicine, FMC Abuja, and CEO Vital Aid Medication Foundation. Thank you, very much for joining us. Vital Aid Medical Foundation. Thank you very much. Nanlop Ogbureke, Executive Director of Resolve to Save Lives, Nigeria. Thank you so much, ma'am, and of course, keep saving lives. Thank you for being a part of the conversation this morning. All right, so that's our package this morning. Check your numbers. I'm Ian Ray John, live locked on the NTA.
And I'm Victor Azo. See you next time.